We are very privileged to have Marnin Romm with us for our podcast. Marnin is a physio of many years' experience, specializing in pain management and pain neuroscience. He is currently completing his PhD at the University of Miami and joins us from Miami. Marnin, welcome. Welcome to the Game Podcast.
Thanks, Nikki. This is exciting. Thanks for having me.
So we were talking a little bit before about pain management, particularly with neonates. That is certainly an interest of mine, and I know that that forms very much a part of an interest of yours. And we were talking a little bit about how it's so perhaps underestimated in many kind of medical circles, just how important it is to kind of gauge and understand the pain that neonates experience in a neonatal context. Perhaps you can share with us a little bit more in terms of what your thinking is around that.
Yeah, of course. So I think what's happened over the years, unfortunately, is because verbally neonates can't really express, I have pain, or I'm scared of the injection, or I'm scared of the blood test that's going to happen. The pain side of things has been ignored in a lot of ICUs or neonatal ICUs, unfortunately. And there are tools and there's measures that one can use, or health care professionals can use, whether it is a doctor, a nurse, a physio, a psychologist working in a neonatal setting, that they can use various instruments and measures to gauge how much pain a baby is in. And those measures are besides the physiological measures, because we know when anyone's in pain, someone's heart rate goes up, blood pressure goes up, and there's various physiological signs that someone might be in distress or in pain. But there's other instruments that are validated, reliable, that look at body language, that look at face grimacing, that look at many other factors that will facilitate someone's understanding of this neonate is in pain or this neonate is in distress. So I think we've got to make it more transparent and acknowledge that children from very young ages and right from the time that they're born have the potential to experience pain. And therefore, it is their right to have their pain managed, as it is the right of an adult to have their pain managed. So it's the right of a neonate to have their pain managed. And so I think it's an interesting discussion to say, okay, well, what are we going to do about this?
Right. So what you're saying actually is there are measures that help doctors or nurses to understand levels at which neonates experience pain. And once they can understand that, well, then they can actually medicate or manage that pain appropriately. And actually, that's incredibly important.
Absolutely. Yeah. I think it's the acknowledgement that neonates experience pain, and the acknowledgement that that pain should be managed. There's major evidence in the literature, in clinical work, that if pain is not managed from early childhood or as a neonate, these individuals can grow up experiencing chronic pain from a very small stimulus. So why is it, we ask as an adult, that one person versus another person develops chronic pain? And there seems to be a correlation between, one of the factors that acts as a correlation or a predictive factor, that if a neonate was having injections, blood tests, those type of things, and their pain was not managed, they have more of a potential likelihood to develop some sort of complex chronic pain syndrome later on in life.
So that it's not just about the infant's right in the moment to have their pain managed, which in some ways is enough actually, but it's also about helping their developmental trajectory, that they don't have that as a complexity later on around, I wasn't managed earlier on and now I am more at risk of developing some kind of chronic pain syndrome.
Absolutely, yeah, absolutely. And I think what defines that is looking at pain and chronic pain through a biopsychosocial lens, and not purely as a bio or physiological medical problem, but actually looking at it through a psychosocial lens. How much comfort was the infant given in the ICU when blood was being taken from the little kiddie? How much comfort or psychological comforting was given to the baby in those situations? And if that wasn't there, and the baby wasn't comforted during a blood test being taken, that's definitely something that's going to act as a catalyst possibly later on in life for someone experiencing chronic pain or complex pain.
Right. I mean, what you've just spoken about resonates hugely with me. And if I think about some of the research that I've been privileged to do in the context of a neonatal ICU, and of course, my samples were very small. So, but just, I guess, thinking about it clinically, where some of the infants who had their mothers present, where mom was quite calm and contained herself, and where she spoke to the baby through the process, that just kind of from an observational perspective, it was interesting for me to notice that breathing often slowed down, and often the physiological markers you were talking about around distress seemed to soften really through that process. And it was interesting that some of the babies for whom there wasn't that kind of mediation sometimes often seem to dissociate, almost kind of cutting off, because, one wonders, was the pain too much? You would see the baby often become a bit limp, or, seem to kind of, the eyes became glazed over. And I wondered to myself, what was happening in that moment? Was that experience too hard to manage? And what did the baby then have to do to cut off from that?
Absolutely. I mean, I think that's a great story of fact that you've given there, and what you've noticed. I mean, that thoroughly and richly presents itself in that psychosocial model of what is happening around the time when there's a noxious stimulus or a dangerous stimulus, such as an injection or a blood test, or anything happening that might be threatening to the baby. How is that environment contained? Is it contained or is it not? And the role that a parental figure and the role that a healthcare professional can take to comfort the baby during those times of potential pain or distress, how that can really play a huge part in how the child psychologically reacts to a noxious stimulus. Right. So I think it's a very, very important point that you bring up, Nikki, is that all babies from whatever age, moving from neonates to early childhood, to adolescence, to adulthood, the experience of pain is so much about how someone is experiencing the pain on a psychological level and a social level, and what expectation is involved around that pain. Are you anticipating pain every time there's a noxious stimulus around? Do you feel comforted or not threatened by a particular noxious stimulus? And that's certainly something that can develop from newborn babies and work its way developmentally up into adulthood.
Mm. And I think what you're saying is so important, is that, I mean, it's one thing to kind of suggest, well, parents, we have to rely on parents, but I think parents are often in that situation quite traumatized themselves. And so I loved what you were saying about that. Actually, it's something to hold in mind for allied professionals. I mean, I remember being in a hospital in Melbourne and was quite blown away by the psychiatrist who was working with the doctor, and some of the advice that was given was, talk to the baby before you give the injection. I'm going to be giving you an injection now, and that seems silly. Why am I talking to a kind of pre-verbal infant? But actually, they found that there was comfort. Exactly what you're talking about. That managing pain is is both kind of biological, but it's also very much psychosocial, even for the preverbal infant.
Absolutely. We know, I mean, through the research that if you are honest and transparent, literally from the word go, about the fact that someone might experience a prick or might experience a little bit of pain, that is more comforting than not knowing. The not knowing side of things is more traumatizing for any individual. So, for example, if you take your child to the doctor for a vaccination and the child is really scared because they're going to get an injection, and you as a parent or as a caregiver say, well, it's going to prick for a little bit and then the pain will go away, instead of saying, no, you're not going to have any pain, you're not going to feel anything. What tends to happen is the child tends to experience way more pain intensity from that injection, for example, when they didn't know or when there wasn't honesty around it versus when there was honesty. And that's all about the anticipation. The unpredictability around pain is way worse than the predictability around pain. And these kids tend to grow up fearing pain to a lesser degree than people growing up and really being scared around any sort of, like I keep saying, noxious stimulus. And that anticipation around it is much scarier and more traumatizing around the not knowing than the knowing.
Right. So actually part of pain management is actually preparation, is really what you're saying.
Absolutely. There's also, just back to that fact, I mean, great evidence and loads of literature and research around pre-surgical intervention and explaining to patients, this is your surgery, this is what's going to happen, this is what you're going to experience after the surgery, this is how we're going to manage it. And there's great predictability around how those individuals experience their pain post-surgery versus the individuals that didn't get any sort of education or information prior to the surgery. And that really feeds into that kind of acknowledging that someone's going to have a little bit of pain, but it will be managed. Again, that's feeding into the psychosocial part of pain management.
Right. Marnin, thank you so much. That feels like such important information, I think, both for parents, but also for professionals working with young children, with infants in a neonatal kind of context, around, just how to manage pain so that they can experience an easier time in the unit, but also that moving forward, pain doesn't have to be something that's catastrophic.
Absolutely, and that's a great word, is catastrophic. People tend to catastrophize when they're in chronic pain. And I think that can happen based on what happened in early childhood and how they were brought up with respect to any sort of potential pain. So thank you very much for the interview. And I love discussing this with you. And I do think that as healthcare professionals, it is a healthcare professional's responsibility, as well as a parent's responsibility, to make sure that from early on, pain is managed properly.
That feels like such an important message, Marnin. We loved having you, and hopefully we look forward to talking to you again.
Yeah, thank you, Nikki.